click the button for records. Exactly, so you could approve it. Then we'll share the recording with you. We also could use Zoom as in terms of questions and answers. So if you have some questions in the meantime, please do not hesitate to share them with us on the chat channel. We try to answer to them during the conference, or we could come back to them during the questions and answers sessions after 2 panels with the presentation of the report and then comments from the stakeholder. Then for interpretation, please use your headsets. It just will be easy for interpretations. And because we have a lot of participants, please maybe switch off your camera if you don't speak. But before you switch off your camera, can you please activate your camera, because we would like to do a screenshot with you participating in this meeting, and Maria will do a screenshot for us. Yes, thank you, Maria. Can you please activate your camera? And then Maria, if you don't, please let us know, okay? Okay, I suggest Maria, we do it. So then I would like to give the floor to our, the people that we all know very well, to open the conference. That is Jan Willem Koudrian, General Secretary of EPSU, and Nicola Kuhn-Toris, Director of Research Department of European Trade Union Institutes.
Thank you, Adam, for starting the meeting, and good afternoon to everybody. As always, a pleasure to see you, and once again, thanks to the ETUI for doing this sort of luncheon session on an important topic with EPSU. For those of you who do not know EPSU, EPSU is the European Federation of Public Service Trade Unions. Here today, we are here especially as the voice of health and social care workers across Europe. EPSU is a pan-European organization, so there are also colleagues from beyond the European Union here with us. In the health and care sector, EPSU organizes both in the public, the non-profit, and in the private sector, and I make a little note of that later on in the presentation. Last year we organized a similar type conference with the ETUI on transforming care work within an era of changing priorities of care policy after the pandemic. And one of the issues we noted at that moment was also the increased psychosocial risks for workers in the health and in the social care sector. Today we also have employers with us. I welcome Marta Branca, who is the General Secretary of HOSPIM, that's the employer organization in the health and in the hospital sector. And I also welcome Sylvain Renouvel, who is the Director of Social Employers. Social Employers is the employers side in the social services sector. EPSU and Social Employers have recently, well, last year already, asked for the setting up of a social dialogue committee for the European social services sector, and we are waiting for an answer from the European Commission. We also have a lot of affiliates here, and one of those, Dietmar Edmeijer from Verdi in Germany, will speak with us. He's the Vice President of our Health and Social Services Committee. And we also have a representative of the European Commission with us, Sol Vega. And I find it difficult to pronounce your family name, so I will not attempt, but she will also make a presentation on behalf of DG Employers, and we're very pleased to be that you are with us. As we know, the issue is stress, and for health and social services workers, the COVID period we have, for the most part, just behind us has been extremely stressful. It also highlighted the issue of low pay for many of our colleagues in that sector, the sometimes abysmal conditions under which they have to do, and all of this is made worse by staff shortages, which is really the scourge of the health and social care sector. For this reason, we're also organizing a European demonstration on the 9th of December, in which we will bring that message around staff shortages and the urgency to address it to the European Ministers of Health and Care. They will be meeting in Brussels at that moment. If I am correct, somebody will put a link to that demonstration in the Zoom chat. And please, if you're in Brussels, don't hesitate to join us on the 9th of December at 11 in Place Madou. The report, we thought, and I hope you all have been able to have a look at it. I'm trying to get it on screen, but this is a failed attempt in trying to master the angle of the camera. Well, anyway, there's a report of the ETUI, and I hope you have been able to read it or at least to skim through it. Many of our affiliates have contributed to this report, especially from Germany, Spain, and Sweden. I think in total there were over 20 interviews which were conducted to prepare this research. This is also the occasion to thank the researchers. Adam already mentioned them in the beginning, and we'll hear later on from some of them. So thanks to the researchers for doing this. And of course, all your input will be helpful for them to continue their work, continue their reflections, and of course for EPSU and our affiliates on how we proceed. For us, we see the report as yet another argument for having a dedicated directive on psychosocial risks and psychosocial risk factors. And we think legislation would lead to improvements because it will force employers to have a proper application of prevention and mitigation measures. And a directive will also put forward sanctions. So we think it could help to improve the health and safety management standards for health and social care. In terms of very few comments of a very rich report, the report highlights the issue of staff shortages and then the need for regulations on staffing. They can be, in some countries, they will be also through collective agreements as a way of addressing this. In other countries, maybe more to regulation for the sector. But staffing shortages are one of the crucial factors now which are contributing to stress in the sector. And almost everywhere where we go and when we speak with affiliates, and there's some of them are also here online, the stress at work due to staff shortages is one of the biggest concerns. Together with also the lack of labor inspectorates and health and safety inspectorates, we think these staff shortages are one of the reasons for these staff shortages, also the lack of funding because of austerity measures. And that is, I think, in the European labor movement, in the ETUC and EPSU, is one of the things we don't want to see back, this coordinated austerity of which we have had a decade with the results in cuts in our budgets for health and social care, downsizing, privatization in some countries, and so on. So the report is also very critical of so-called new labor management practices. I reckon you will hear some of that in the discussions later on. Labor management practices which look at more flexibility, which try to have productive performance, but also put forward profitability. And these are then also factors which contribute to psychosocial risks and then ill health. And that is what we want to prevent. Also in the light of the campaign of the ETUC, also to have zero accidents at work, and stress can also be an accident at work. So preventing a harmful work environment, I think, is a very big motive of the labor movement to which we want to contribute, and we think this report has contributed to that, and something we want to take further in our discussions. So with that, I close the remarks for EPSU and give the floor now to Nicola, the Director of the ETUI Research Arm. Nicola, over to you. And many thanks for the cooperation.
Thank you very much, Jan Willem. Thank you very much, Adam. It was a real pleasure for the institution. I also hear from my colleagues who were directly involved in the production of this report. It was a genuine pleasure for them to interact with EPSU and the trade unions that assisted, your affiliates that assisted in the process of drafting. So thank you so much. I think it's no more than a couple of years since we came up with that magic catchphrase. I'm sure all of you remember it. It was something like building back better. In the midst of the pandemic, once we had realized who were the real essential workers, we also promised to each other, it was almost a new social contract in the making, that we would learn the lessons from the pandemic. We would learn the lessons from the period prior to the pandemic that had really stretched to its limits the social fabric and the economic fabric of Europe after a decade of austerity. And we're going to build back better. But I think this report and what you've heard from Jan Willem Gordijn prove that unfortunately we have so far passed on the opportunity of building back better. It hasn't been much more than a slogan. And in fact, having decided that workers in the health sector and in the long-term sector were the real heroes of the pandemic, they were the real essential workers, we are currently neglecting them, and we're currently neglecting them on the back of mounting evidence that in the past 2 years, they have suffered disproportionately, and the sectors in which they work have suffered disproportionately, in spite of the great need and the great contributions they have made to the resilience of our societies. What this report allows us to do is to finally shift on an evidence-based basis our attention from the individual, almost individualistic dimension of psychosocial risk as an individual failing, an individual fragility, to the institutional and collective dimensions of the problem. It allows us to focus on the contributory effects of work organizations and employment conditions, including, broadly understood, the employment conditions that are determined by funding, by shortages, including staff shortages, to the well-being and mental health of the workers in the sector. Clearly, the question of resources is the big elephant in the room in the current debate. And this helps us even more to put the emphasis on the collective and organizational dimension of psychosocial risks. Psychosocial risks have been a long-standing interest for the European Trade Union Institute and for my colleagues in particular of the third unit of the research department, today represented by one of the co-authors of this report, Dr. Paula Franklin, and by the head of unit, Maria Chapman, who will speak and offer some concluding remarks in today's event. But these are really important times. They're important times because first, we can really make good the building back better promise. And then we can also take this opportunity to understand that we are going through an important shift in our societies and in our economies. Another project that the ETUI and EPSU have been collaborating on is the project on post-growth welfare states and post-growth economies. As part of this project, we have systematically identified the possibility of basing future sustainability on ideas that are related to wellness and to the provision of those services in an economy that really matter to the well-being of today's and tomorrow's citizens. As part of those projects, we have clearly identified the personal long-term care sectors and the health sectors as strategically important in the creation of a new wellness economy based on the well-being of our societies. But it's impossible to imagine a wellness economy unless the key workers that participate in its structuring and delivery are also treated fairly. And how can they be treated fairly when it is evident that those at the core of that potential transformation are so adversely affected by psychosocial risks, mental health, and actual proper health issues disproportionately to other segments of the labor force. I would like to stop here and allow you to hear from the real experts, the ones that have really carried out this research. So if I may, I would like to introduce Dr. Paula Franklin, who's a senior researcher and has worked on this topic for a long period of time. And the co-authors in her report, Clara Lawrence Serrano, Claudio Narowski, Clara Gual, Barbara Helfernick, and two of those are here with us today, Clara Lawrence Serrano and Barbara Helfernick. They will help us understand the conundrum, the contradiction of these essential workers who are being failed by the social contract that we established just a couple of years ago, the contract of building back better. Thank you. And Jan Willem, thank you very much for hosting this extremely interesting event.
Yes, thank you, Nicola. In the meantime, we figure out that we could have some technical problems. Therefore, the numbers are only 100. We try to figure out what to do as soon as possible, and fix these problems of the participants, because we already have, as I said, 300 registered. So we will send an email or make sure that some people could join the meeting. But without that, I would like to give the floor to Paola, to Franklin, to moderate the first panel when we know about the report and the guidelines. Paola, the floor is yours.
Thank you, Adam, and thank you, Nicola and Jan Willem, for opening the meeting, and a warm welcome on my behalf as well. As was said, my name is Paola Franklin, and I work as a senior researcher at the ETUI and the Occupational Safety and Health units, and I have had the pleasure to coordinate the projects on the ETUI project on work-related psychosocial risks in the healthcare and long-term care sectors. And the report that we are launching here is now available at the ETUI websites, and the participants of this event can also request for free an actual printed copy of the report in English. And we have also prepared a shorter publication which is based on the report, and this is a trade union guide on psychosocial risk prevention in the health and long-term care sectors. The guide is available in English, German, Spanish, and Swedish. And in the chat box of the meeting, you can find a link through which you can order your copy of the report and the guide. Now, before giving the floor to the experts who've done the research work, just a few words about the report as a background. So the report provides a review of scientific evidence of psychosocial risks in the healthcare and long-term care sectors, as well as an analysis of interview data collected from German, Spanish, and Swedish trade unions on this critical issue. Based on the evidence review and the interview data analysis, the report outlines the main sources of psychosocial risks in these sectors, and it illustrates them with the voice of worker representatives. What we find is that the negative health impacts of psychosocial risks are evident on the workers, and these were brought to everyone's attention by the COVID-19 pandemic. But while the psychosocial risk impacts are clear at the individual level as physical and mental health problems, different health outcomes, the sources and the factors, so the reasons for poor health, are found in work organization and employment conditions. And therefore, the effective prevention of PSR should take place at the collective level and not only address the individual worker. So we are now very happy to welcome two researchers who were involved in this project to share some of the key findings with us today. First, we have Clara Lawrence Serrano, who is a senior researcher at ISTAS, which is the Trade Union Institute of Work, Environment and Health, affiliated with the Spanish Trade Union Confederation, Comisiones Obreras. Clara is an expert of psychosocial risks and published broadly on the topic, including on the issues concerning specifically the health sector. Clara will tell us about the sources and factors of PSR in these sectors and highlight some of the preventive measures. The second speaker is Barbara Helferich, who is an independent researcher and consultant on gender and a co-founder of the European feminist think tank Gender 5+. Barbara has a long track record on analyzing gender inequalities in the labor market, including the reasons why care work remains undervalued and the state of current care systems in Europe. For this project, Barbara interviewed trade unions, health and safety representatives, and she will illustrate the drastic situation with work-related psychosocial risks in these sectors as experienced by workers. So now we will hear about 15 minutes presentations, and I encourage the participants to write your questions throughout the presentation and the whole session we have today in the chat box, so we can have a lively discussion towards the end of this meeting. But now, Clara, please, the floor is yours.
Thank you very much. And as we agreed, I will speak in Spanish. I will share first my screen. Hope everybody can see the screen.
Yes.
Is it okay? All right. Okay, then I will speak in Spanish for a little while. En primer lugar, quiero agradecer esta invitación a EPSU y a ETUI, que me va a permitir aprender de los conocimientos y de las experiencias de aquellos y aquellas que me acompañan en las mesas y de todas y todos ustedes. Paula me pidió que hiciera un pequeño resumen del trabajo realizado entre enero y marzo de 2021. Fue nosotros desde ISTAS, la Fundación 1 de Mayo de Comisiones Obreras, hicimos la revisión bibliográfica de la evidencia científica relativa a los riesgos psicosociales, al origen de los mismos y a su prevención, específicamente en los sectores sanitario y de cuidado de larga duración o de la dependencia, como decimos en España. Utilizando las bases de artículos científicos en el área de salud ocupacional, Medline, pero también Scopus, realizamos una selección de los artículos publicados en los últimos 10 años antes de la pandemia, de 2010 a 2020, y se eligieron artículos cuyo objeto de estudio fueran las causas de las exposiciones nocivas a los riesgos psicosociales o las medidas preventivas para su reducción en origen, cambiando las condiciones de trabajo. Aunque hay lagunas muy importantes, sobre todo en relación con el sector de la dependencia, este informe...
Important papers and articles regarding also long-term care sectors and healthcare, and it has already been said by some of the previous speakers, what we have mainly seen were changes regarding staffing. So what do we talk about when we talk about psychosocial risk, so PSR? I think that all of us know well this area for the prevention of PSR. We had already a mixed committee of the ILO defined a long time ago the PSR as work conditions that were present in the work sphere and that were related to the organization of work with the way work was carried out, and they could have an impact both on the physical and mental health of workers. So when we talk about PSR, we are not talking about the intrinsic conditions of the task, and they're not related to the personality of the workers, but rather on how the task is carried out. So factors that can be modified, we're talking about work conditions that are derived from the organization of work. So how we carry out work and not what we are doing. In other words, PSR are specific characteristics of the organization of work. Therefore, work conditions that have an impact on us. Although they have an impact, psychosocial impact, their origin is rather social. They have a psycho impact, but their origin is social. And it has been shown that they generate health problems. Otherwise, we could not talk about risk, and we cannot demand of companies and employers their prevention or to take action. Regarding these risks, we see there is a lot of evidence. There have been already evidence from the 30s of the last century, so the 1930s, and we could fill rooms with papers that already identify these characteristics of the work organization that have an impact, negative impact on the health of workers, and that already have a huge impact regarding specific illnesses, for example, and diseases. And this is why they are considered determinant factors regarding health. Right now, the evidence that we have on health problems, and when we are talking about this type of risk, is quite extensive, and there's high quality evidence from a scientific point of view, because it is based on long-term investigation. So we have been able to follow workers that were healthy, and there's a follow-up throughout their labor life. EPSU, for example, has data of 600,000 workers, both male and female, and there it is able to conclude the factors in what degree they are determined, and also through this long-term studies, and we're able to determine what is the impact of the different factors on different health conditions. So we have very large samples and very long studies. So we see that there are associations between the different work conditions and the health of the workers. And I have just wanted to show you here a graph, and we see this of a meta review of 72 literature reviews with meta-analysis, so published in the last 20 years. And here I've tried to summarize the data of the higher quality studies according to the authors, and only regarding depression, so one health factor. So when we analyze the data of this very high level studies as qualified by experts, as we can see here by Need, Harman, and Betray, and we see being exposed to high demands, high volume of work according to the time available during the day. So higher volume of work that can be carried out for the time impaired, and a higher control of work, low autonomy, and the possibility to apply knowledge and capacities. This implies an increase of the possibilities of having a depression in 77%. So when we're working in these conditions, again, of high demands and low control, so the incidence of depression is much higher, the risk. If the demands are high and the level of rewards is low salary, low recognition, for example, we also see that there's a higher possibility of having a depression, in this case, 66%. And if we're talking about high job insecurity, depression, the risk of depression can increase in 61%. So all these conditions, the high demands, the low control, the low recognition, for example, through salaries, they are conditions that have a very clearly characterized in these two sectors, so the healthcare sector and the long-term care sector. So the authors show that the association between the different factors, they don't see substantial differences regarding gender, for example. So if we work in these conditions, you might get sick, and it's regardless of your gender or the post that you have, be it higher or lower. As we can already imagine, the prevalence of the exposition to this risk is not equal. We see that, for example, regarding the low control autonomy and possibilities to apply knowledge and capacities is more prevalent, for example, in jobs with less security. So this is what we have right now. So here we just have a graph, a table from one paper, and this allows us to say that within the different factors of different type of diseases, for example, depression in this case, we see the incidence of psychosocial risk. It goes beyond a health problem, individual health problem. It is a public health problem.
Comparativamente con los estudios de
What can we do in comparison with the studies of psychosocial risks? There are few studies that focus on the measures to combat these risks, but from those evidences, we cannot deny the value of acting in the work organization and focusing the changes on the work organization. In the European context, this is especially clear. And since 1984, since 1989, I wanted to say, so a long time ago anyway, with the transposition of the Health and Safety Directive, there is a priority on the preventative actions, as we can see in the article, which means reducing the risks at the workplace and promoting changes in the working conditions. So at the point of origin of these risks. Only a month, a bit more ago, these preventative principles to assess and prevent these aspects in order to change the working conditions are gathered in a policy brief from the ILO and the World Health Organization. And this is a first step to promote health safety at the workplace, prevent psychosocial risks, foreseeing organizational interventions, changing, for instance, the high demands, the low autonomy, etc. And we have a few examples also on how to do this. Like, for instance, to have a flexibility in the work hours, to adapt to the needs of the worker, etc. But what can we see that the scientific evidence shows for long-term care? I will only focus on one line, and you can find the rest in the report that is presented today. I invite you to read it and to work with it as a tool for trade union action and action also towards the companies. According to the literature, the understaffing is the most prevalent source of psychosocial risk exposures. So it is the most important and most prevalent in that sector. And the increase in staff can improve the exposition to those risks. And the low staffing means high demand, with ratios that are excessive between patients and staff. And this is also something that has to do with the low support from colleagues, because if the load is excessive, then you have no time to help the colleagues at work, and you cannot foresee time for team meetings, for instance, in order to share the problems and find solutions. And this understaffing is also related to the conflict between work and family time, because there is no possibility to take into account the needs. And the objective is to cover the staffing at the minimum price. And so that is the scheduling, let's say, is only focusing on the reducing the cost for the staffing, and the redesign of tasks, for instance, increasing functions or having more participative ways of working when there is understaffing intensifies the work and puts in jeopardy the positive impacts of those measures, so the redesigning of the tasks. And that has an effect on health with a reduced possibility to use those positive or to have this positive effects, because there is a context of understaffing, and this redesign of the task or introduction of participative methods cannot really lead to those positive effects expected. Also, the understaffing is an obstacle to the reduction of the exposure time to emotional difficulty. So according to the scientific evidence, this is something that can help. But when there is understaffing, it is impossible to reduce the number of patients, for instance, or residents, or you cannot have group therapy, for instance, to focus on these aspects during working hours. So these cannot be reduced. And the other aspects like conflict family work are not intrinsical. For instance, doctors, nurses, etc., but they are characterized in many studies, and we can find them also in the complaints of many workers that are taking to the streets and that will take to the streets again. And if it's not something that is intrinsical, it can be changed, maybe not eradicated, but be reduced. And that is the understaffing is something that can be changed, and this is regulated also in many countries. And we see that understaffing is increasing because the budget are being reduced, or also due to other reasons. According to the scientific evidence, that is what we see. Also, the privatization trend increases that understaffing, or implementing new management models that do not recognize the work that is the care work that is part of that assistential work, and that very often is invisible or not enough documented or quantified. And the time to take into or to carry out those tasks is not taken into account, because the staff is very often made up of women, and it is not valued sufficiently, according to the studies that I consulted. So the increase in staff would improve, according to the scientific evidence, that the working conditions, the health, the retention of those professions, the quality of the care in these sectors. The governments could use also public tendering criteria in order to improve that aspect, and also this could lead to a better redesigning of the tasks and increasing the staff. Thank you very much, and I will now give the floor to the next speaker.
Thank you, Clara. Thank you very much for sharing with us some of the evidence, especially on the health impacts of psychosocial risks. So there is no doubt that psychosocial risks in work environment can cause, for example, depression. This is very established. And also highlighting the staffing issue, and we can kind of see a vicious cycle there, that understaffing creates psychosocial risks. that in turn cause staff absence due to making them ill, which leads to further lack of staff. So I think this is something that we can bring into the discussions later as well. But now, for the sake of time, I am giving the floor directly to Barbara Helfferich and her presentation based on the reports and specifically the interviews with the trade unions. Barbara, the floor is yours.
Well, thank you very much, Paula, and thank you very much to the ETUI for inviting me and giving me the opportunity to do this study, this qualitative study. Let me start out by giving you a bit of background on the kinds of things that Paula instructed me to do, and which then ultimately led to a fascinating series of interviews and conclusions. So the aim of the study was to give voice to trade union officials, in particular those involved in health and safety, and those involved in collective bargaining. And what we were trying to do was looking for evidence of the crisis in the healthcare and long-term care sectors. And we know that even before COVID, the issue of disinvestment in the sectors was evident, that there was an increasing monetization of the sectors, both in the healthcare sector and the long-term care sectors. And then, of course, following with the restructuring of the sectors, and particularly also using new management, practices. So given all this, what was happening, what was really happening in these sectors, and how did trade unions respond to it? And that was the task that I had to perform. And I was looking into countries like Sweden, Spain, and Germany, and trying to discern the impact of the crisis on workers and also on workers' representation, that is collective bargaining and working with Works Council. And in the end, just looking for options of mitigation and prevention, and particularly, again, what trade unions have done to counter PSR, psychosocial risks, how can they be mitigated and even prevented. So with this kind of task, I've set out to look at and talk to trade unions and see what they had to say about it. So I was tasked with a qualitative study, and that again focusing on Germany, Spain, and Sweden. And the goal was to use semi-structured interviews and talk to trade union officials involved in safety and health, and in particular members of the sectoral social dialogue committee. And given, sorry, I just don't. I'm sorry, my computer just did something. So again, the methodology was to have semi-structured interviews and talk to trade unionists involved in safety and health issues, and in particular members of the sectoral social dialogue committee. The interviews normally took place via Zoom or through other internet platforms, and involved in particular those who have been very much involved also in Works Council and at the floor level. So what happened was that these interviews completely bore out that which we already know from the scientific evidence that Clara just presented, that health and safety concerns and psychosocial risks are not just an individual issue and problem, but very much related to the work environment and the working conditions. So investigating these working conditions which contributed to PSR was one of the things that I looked at. I looked at the quantitative demands, the low recognition, what kind of support the workers in the care sectors and healthcare and long-term care sectors were receiving. I looked at all these issues that constitute psychosocial risks, and I looked at Germany, Spain, and Sweden. Particularly interesting were the responses of the trade union action in terms of prevention and mitigation. In particular, we heard from many trade unionists about lobbying for better legislation, collective bargaining, and industry action was one of the issues, are the issues that were at the center of addressing PSRs in terms of prevention and mitigation. I also looked at the kinds of risk assessments that were taking place in some countries and other tools and approaches of trade unions in relation to preventing and mitigation PSRs, psychosocial risks. Looking at Germany, for example, trade unions reported that they concentrated on the creation of works councils in healthcare and elderly organizations. They also showed recent successes with concluding important collective agreements, in particular in the hospital sector. In the interviews, it was said that it is an estimation of only 10% of long-term care institutions in Germany have work council. And all the recent research indicates that workers in the healthcare and care sectors are more reluctant to strike. Strike action can be a very effective means of bringing positive results in these sectors. When I interviewed trade union officials in Spain, the conditions obviously are quite different. In Spain, we already have a law that obliges employer to undertake risk assessment, which includes also PSRs. But we also heard, or I also heard, that the majority of these companies that are obliged to do and engage in providing risk assessment just didn't do them. So trade unions do have the opportunity to address address this as a legal case and pressure for monitoring and better follow-up. But many trade unions opted to go via the equality plans, which in Spain requires companies which have more than 50 workers to present and apply an equality plan to ensure equal treatment between women and men. So one of the ways for trade union to address it is via an equality plan, because the majority of workers in these sectors are women. Other ways of dealing with it from the Spanish side was to draft counter reports. That is, when there was a risk assessment and the risk assessment stated that staffing was enough, for example, and there was a more control that the workers were receiving, trade unions would be able to or undertook to draft counter reports, and that's that providing, for example, issues of greater flexibility or demanding hiring more personnel, or to just address in general the high quantitative demands that workers in these sectors were faced with. In relation to Sweden, we see again a very different approach, and Sweden being what it is, working with municipalities is important for trade unions in relation to the health, safety and health of workers. So the Trade Union Confederation of Law started to work with almost 300 municipalities, and that was long before the COVID pandemic, addressing staff shortages directly linked to PSR, and also bringing teams of experts to those places where there was a high risk of sick leave or already established high sick leave reported. Other issues on other strategies that were used is to strategize and to develop a strategy at the workplace in Sweden, outlining what needs to be done in terms of addressing staffing, working time, and other threats, in particular violence, which is a whole different, not a different, but it is a very central issue when we're talking about PSRs in the care sectors. So, in conclusion, despite the diverse contexts of Germany, Spain, and Sweden, we do see that the sources of PSR are pretty similar, and that we can also see the negative health outcomes, and that they are convergent. On the other hand, we do see that trade unions are responding in a very flexible manner, using diverse approaches to address PSR in their particular countries and in their particular context. What seems to be, however, one of the major issues is that the resources that trade unions have at their disposal to address PSRs remain limited in all countries, be it Germany, Spain, or Sweden. So what are some of the important takeaways from this study, from this qualitative assessment of the situations? So we know sources and impacts and their rise through working conditions. And that PSRs can translate into emotional behavior and physical symptoms. We understand that PSRs are evident in healthcare and long-term care sectors, particularly prominent. We know that sick leave rates are very high. In Spain, it is, from the interviews, it is these are the sectors with the highest sick leave rates of all other sectors. Similarly, Sweden reports a very high sick leave rate in the healthcare and long-term care sectors. We also know that workers are not equally protected from psychosocial risks across the different member states. And what is oftentimes overlooked in discussing PSR is the strong gender dimension, particularly evident in the segregation of the labor market, and more than 80% of workers in the healthcare and long-term care sectors are women, and that needs to be taken account when we're talking about any mitigation and prevention measures. So priority should be given to preventive actions that I think blends in with the scientific evidence of what is most appropriate to address PSRs. That workplaces must regularly conduct proper assessments of PSRs, and here the issue of resources, political will is important. Prevention, as Paula already said, is most effective when collective and not individual. And it is very important to apply a gender lens in a very structured way. And then the unionization, the promotion of collective bargaining with a focus on PSR is an important driver to address the PSR through mitigation and prevention. And there is, of course, a need for EU legislation. In this context, the ETUI and its affiliates have been campaigning for a directive that addresses psychosocial risks in the workplace, and it should not be. We should take advantage of the post-COVID or COVID crisis, which really brought to the fore the tremendously important nature of care work. So in terms of addressing the care crisis, it would be important to have that particular EU legislation in order to provide a uniform way of addressing psychosocial risks in the workplace, in particular in the care and in the healthcare and long-term care sectors. Again, I came away from the study not astonished that the care sectors and the long-term care sector is under such crises. The stories that I heard from trade union officials and those involved in caring are incredible and give evidence to the fact that the care sector is really in a crisis, and addressing PSRs is one of the most important things that we need to address in relation to trade union work in this sector. And let me stop at this point and thank you very much for giving me the opportunity to do this study. And I would also like to thank at this point all the people I interviewed, their tremendous knowledge and support in collecting this type of information, which is not quantitative, but it is indeed very qualitative. And thank you very much.
Thank you, Barbara, for giving us a kind of a glimpse of the impacts of psychosocial risks in the 3 countries, and also about the trade union action in this key area of what I would say the 21st century occupational safety and health issues. And if any of you in the audience are wondering why these 3 countries, there is information in the reports, but let's just say that this relates to different industrial relations in the countries, as well as the difference in terms of health and long-term care systems. But as I said, there is more information in the report. So just to say that Clara presented the scientific evidence review, some key points from there, and as we heard, Barbara was then picking up on the findings of the review and used the review as a semi-structured interview questionnaire when talking to the trade unions in the 3 countries. So this is how the report comes together. This is how the findings come together. But now I can see that we are slightly behind the schedule. So I'm passing the floor directly to Adam to chair the next panel. So thank you very much.
Thank you very much, Paula, and thank you for presentation this excellent report. As you probably noticed as well, we had some issues, technical issues, but we solved those issues. In Zoom, we also have a chat channel is working there. Kevin Flynn from the Eurocards put some information about the campaign that the trade unions are supporting very much. And stress is about the directive on psychosocial risk factors. I would like now to give the floor to our important stakeholders who will be probably using this excellent report in their daily activities. And in this panel, we'll be actually looking how we could make sure that health and long-term care jobs are mentally health friendly. So first of all, it will be Sylvia Novel, then Dietmar Erdmeier, Marta Brandka, and our colleague from the DG Employment, Solviga Eiduka Naitė-Gerard, I think it's the first surname is Lithuanian. So given that the time frame, maybe if you could, we could reduce your presentation to 7 minutes would be very much appreciated. So Sylvain, are you with us? Can you?
Yes, I am with you. I
hope
I don't have any issue with my microphone, but it sounds to be working.
Yeah, yes, it works very well. It works very well.
Thank you. Yes, indeed. I'm Sylvain. Thank you for the invitation to this meeting. I'm Sylvain Renouvelle. I represent the social employers. It's a rather new organization created in 2017. And we gather partners from all over Europe, 30 partners who are active in elderly care, person with disabilities, and also child protection. So it's about long-term care, but not only long-term care. So we cover we cover this sector plus others, and we've been working for a long time with EPSU on many projects. We mentioned that we work on social dialogue development in many countries. We work on attractiveness, and we work on training skills, as well as working conditions. So we work quite well together, and we will work also in the future on this topic particularly. I would have two main points about the topic of today. It has been addressed. We have faced the 2008 crisis, which has led to cuts in terms of funding. And I think, I'm convinced, that the situation of workers in the sector have been worsened, working conditions have been worsened because less funding means less staff to do the job, lower staff ratios, and many things that have led to quite poor working conditions, particularly in long-term care. But I think we have an opportunity now. It's the European Care Strategy, which has been launched by the Commission. And I think we, as social partners on both sides, we have to support this initiative, because this initiative calls member states to invest in social services. So it asks to reduce, to change the mindset of authorities and to make them spend money on our services. My screen, I see Anna Martinez on my screen, but I hope it still works. Can you confirm, Adam?
Now you want to screenshot, right, or what?
No. It wasn't working. It's okay.
No, we're still listening to you. If you know, then I will let you know. Okay, thank you. Okay,
thank you. And so we have to support together and to make member states implement this new strategy and to invest in social services. This will allow us to provide better staff users ratios and face understaffing. And in order not to make them not only be able to make a technical task, but also a social task. We need to speak to people. It's not only technical, and the care is about also social. Less time pressure will allow them to work better. And of course, that's obvious, better funding will lead to better wages. We are in a sector where employers agree with trade unions in the idea of improving wages, because it's a question of funding. Employers would like to improve wages, but most often they cannot because of insufficient funding. So it's a question of means, and maybe the second point I would like to address is the question of reflection about work organization and management. I admit, as an employer, that we can make better things. We can improve the management and the organization. We have to think about it, to reflect, to go towards an evolution of the way we manage the services. Today, something important to take into account is that most of the social services, including long-term care services, as nursing homes and so on, have a very small management team. And what this management team has to day to day has to deal with emergency and the long-term policies, improving working conditions and so on. It's something that it is difficult to address for them, as well as better communication with the staff and so on. So I would say once we get additional funding, we could work better with more coordination of the teams. Maybe one of the means could be to have more team coordinators, but everything I'm quite open about this. But coordination would help to find with the staff solution for work schedules, for example, to cooperate, to inform better the staff, to find a better balance between the work schedules and the family duties. Many things that are very important to improve working conditions and to face psychological risk, psychosocial risk. More broadly, we could think also because also the staff is changing and the new generations ask for more cooperation, maybe for more autonomy also, and they want to be more heard by the management. So that's something to work on, and I guess that's something that the managers have to work on and improve. But of course, they need time for this, and they need means for this. Also, as they lack some time, I think we have. I'm not enthusiastic when I hear about new legislation. I would say more pragmatically, it would be relevant to have more toolkits and more concrete tools to allow them to improve working conditions and to prevent psychosocial risk. I will mention about this that EU OSHA works on a big project, and we will be associated to this big project to gather good practices and to make some recommendations about how to improve working conditions in both healthcare and social care sector, and that's something we will contribute to. Last thing, and to conclude, I would say to make a focus on the psychosocial risk is something obvious, that's important, and that's a way to tackle the problem. But I would say this problem has to be taken also in an holistic approach, because everybody knows that psychosocial risks are linked to the other big risk in the sector, which is musculoskeletal disorders, as well as the question of gender, question of working conditions, the question of activeness. Everything is linked. So I think we have to address, when we talk about action, we have to address all these things all together. And that's something very important in my opinion. And last word, I would say, because I saw this in the report, in my opinion, and I think it's quite well known, that that kind of task must be led by the employers on one side, but with deep cooperation with the staff and the representative of the staff. That's the only condition to make it work. Thank you.
Thank you very much, Sylvain, for your comments, and thank you very much for sticking to the time limit of 7 minutes. That's very much appreciated, because we want to have some sort of discussion at the end. So then I give the floor to Dietmar Eitmaier, who is a Vice President of EPSU Standing Committee on Health and Social Services, but also is working for the German trade union Verdi. Dietmar, the floor is yours.
Ja, vielen Dank, Adam. Vielen Dank für die wichtige Studie.
Thank you, Adam. Thank you for the invitation. Thank you for organizing the meeting. And thank you for the report, which is quite important. Thank you once again for organizing the conference. We can see that it's not an issue of understanding, but of implementation. Before COVID, there was already quite a high need of extending the staff. There were a lot of people who fell sick because of COVID, because of the stress in the sector of health and long-term health care. The pressure is still increasing. We heard a lot of things being said on the daily life of our workers. All that is quite important. We need better working hours to reconcile family and working lives. We need also a system of coordination between the workers, psychiatric advices, and the employers also have a role to play, of course, in staff development and in improving the prevention culture within the company, something that should be even more dynamic and start with train. I'd like to contradict Sylvain on this last item. Indeed, companies are more and more competing in trying to attract competent staff. I'm quite happy to work on this with the social partner, and I hope that this can be even improved in the framework of a future social dialogue in order to tackle this important topic at European level. From a union's point of view, there are two main objectives. First, two main targets for this report. First, the employers, because what we advocate for as representative of the interests of the worker, we would like to have the employers discuss with us about the collective agreements in Germany. Company agreements can already improve the working conditions in the health sector at company level in order to solve all the issues that we refer to during the meeting, and in order to have the workers face their responsibilities. To answer Barbara and what she said about the fact that we fought for important collective agreements, that's true. It was a long fight, and the staff says now, I don't like it, I'm going to leave this job and I won't ever come back. I will leave totally this sector, even if they do love their work and they have been in awe with the sector for many years. It may be that we lost them forever. There has been a study on return to the sector, and it seems that we lost a lot of people in our sector, people who would be ready to come back in the sector. So I would like to advocate for trying to discuss together in order to attract in the sector those who left the sector through an improvement of the framework. Of course, we cannot solve everything through individual collective agreements, sectoral collective agreements. That's true. It will not be possible to solve everything through agreements. So there's another target in our work. Politicians, decision takers, and Clara rightly said so, will have also to voice our demands vis-à-vis towards the political world. More coordination in the health sector. They should highlight the quality of work and to have quality services. We need well-trained and committed staff. We need more collective agreements, that's true, but another message is important. We also need national policies. We need a capacity to now implement the legislation on health and hygiene. Risk assessment is an important tool that has to be used to acknowledge the factors of risk, but we also need monitoring and sanctions. Something else is quite important and directed towards the decision takers, the directive on psychosocial risks, which would be important because of the level of stress, which is still increasing. We'll also have to work at that level. So we might have to work on a directive. And this also applies to the recognition of psychosocial diseases as a professional, occupational disease. Of course, it's quite difficult to to prove the causes of these diseases, of these illnesses, but only by doing so we will be able to sustain our manpower and to attract new workers in our sector. That's what I wanted to say. Once again, thank you for your invitation and thank you for giving me the floor.
Thank you,
Dietmar.
Dietmar.
Adam.
Yes, thank you, Dietmar, for these important words about the role of the social partners, so trade unions and employers' organization. And now we are moving now to another employers from the HOSPIM, so Hospital Association, Marta Branca, who is the Secretary General of the HOSPIM organization. Marta, the floor is yours. Are you with us, Marta?
Yes, thank you, Adam. Thank you, EPSU and ETUI for the invitation to join to the interesting event today. I am the Secretary General of HOSPIM, that is European Hospital and Healthcare Employers Association. Our members are independent health employer organizations with the powers to negotiate on pay and term conditions of service with their respective trade unions partners. And since 2006, HOSPIM is recognized as a social partner representing the employers in the sector of social dialogue for hospital and healthcare. And we work with EPSU to assure a sectoral social dialogue in the health sector, active and effective. Okay, in this presentation, I want to say that social partners have been looking at psychosocial risk and stress at work since before the pandemic. Today, I will first widen the scope a bit before looking at the past and ongoing initiatives to illustrate how we are working on this question. This is embedded in a wider context of challenges that this sector is facing. These challenges are very complex due to different societal and economic factors. An aging workforce and a lower amount of new recruits, leading to shortages of healthcare professionals, as you already considered, retention in a number of health occupations, an aging society with new care patterns and a rising number of elderly patients and patients with chronic conditions, multimorbidity, obesity and dementia. Digitalization and new introduction of technologies to healthcare that can require regular upgrading and upskilling. And referring to this, I would like to promote the upcoming HOSPIM EPSU technical seminar on digital and not digital skills of healthcare professionals that will take place the next 30 of November online. And this is going to be an excellent occasion to exchange on integrated care and digital skills for healthcare. Europe's hospital sector is dealing with the consequences of acute staff shortages at the moment, resulting in some regions not being able to deliver the care they aim to deliver for. We are aware that like musculoskeletal disorders or other occupational safety and health aspects, psychosocial risks and stress at work is affected by these challenges and can also further impact the challenges through the motivated workers and the demotivated workforce, as I already heard in this seminar today. We are hence implementing a good occupational safety and health policy contributes to a more efficient way of tackling these challenges, contributes to the work atmosphere in each place, contributes to a more resilient health system. In addition to the report presented today, there are even some studies that give us a general idea of the impact of psychosocial risks in the sector and on the general labor market. Interesting, I believe, for all of us present here is the most recent WHO ILO policy brief on mental health at work, which emphasized the importance of preventing exposure to psychosocial risk at work to protect and promote mental health and well-being at work. The European social partners have adopted specific documents that address, amongst different issues, psychosocial risks and stress at work. There is, for instance, the updated framework of action on recruitment and retention. And in this document, both social partners acknowledge that a comprehensive risk assessment, as you already say today, is key to prevent and reduce psychosocial risks and stress at work, taking place at the organizational, team, and individual levels. EPSU and OSPIM are committed to support the development of measures aiming improve the protection from psychosocial risks and stress at work, including through the current strategic framework of occupational safety and health 2022-2027. Another example are the multi-sectoral guidelines to tackle third-party violence and harassment related to work from 2010. Just to check my time, really a few minutes. Okay, so I can maybe short this intervention. Furthermore, OSPIM has been and is an active campaign partner of EU OSHA Health Workplaces campaigns. Together with EPSU as our social partner, we have been implementing projects financially supported by the European Commission that have tackled the PSR before. For example, in 2015, the conference in Helsinki, or 2018, the conference in Vilnius. This conference on musculoskeletal disorders and psychosocial risk at work highlighted, for instance, a good example is to make economic consequences of absenteeism, of PSR and physical exhaustion visible in organizational results in order to raise awareness with senior management. It furthermore also illustrated the role of risk assessment. And there is also the Eisner study by the EU OSHA agency showed that the health sector is one of the most aware sectors of occupational safety and health policies. It is the sector is most likely to have well-developed psychosocial risk management. I know that my time is finished. Anyway, let me say just 1 minute also. Health sector, included its workforce, has shown its adaptability and resilience in past years, but was already under heavy constraints before the COVID-19 pandemic. I do want to point out the extraordinariness of this situation we are in. Second, there are many different factors that can become a psychosocial risk. They might share general trends, but are always shaped by the implementation at the specific workplace. Adding more regulation on top of what exists might not provide the added value some might hope for. I want to argue to look at what is already there. Social partners know what to do. There are plenty of approaches, plenty of different legislations across Europe that exist. The question is how to implement it. Eventually, a final remark, social dialogue is crucial here for the implementation. Unfortunately, it's not strong everywhere in the Union. Hence, capacity building of social partners is important to ensure the infrastructure for successful industrial relations so that challenges like psychosocial risks can be dealt with effectively. Thank you for your attention and sorry for having go over my 7 minutes. Thank you.
No worries. Thank you very much, Marta. I think what you said is extremely important in terms of supporting social dialogue. And I think we have tools on that on the European level because of the directive of adequate wages, which was then decided, approved in October, wants to support member states to have a collective bargaining on the 80%. And I think what you said is actually this is the crucial role of the social partners, and we need to have more collective bargaining agreements across Europe in order to address the problems of the health and social care sector. So not only in Germany or in Italy, but also in Eastern Europe, like Poland, Czech Republic, where I come from Poland. Then I would like to give the floor to our most important guest, because probably there will be a lot of questions to commissions. We want to use this opportunity, given that the commissions published the care strategy in September, given that today the budget for the next year was approved, budget which has a significant amount of money for the care sector. I would like to give the floor to Solveiga Gerard from DG Employment to share with us her comments and actually to tell us how to pronounce your surname correctly. So Solveiga, you have the floor.
Hello, Adam.
Are you with us?
Yes, can you hear me?
I can hear you very well, yes.
Okay, hello. Hello, Adam, and hello, everyone. I'm happy to be here. So my name is Solveiga Gerard. I'm Lithuanian married to a French, so that's the compound name. It's quite complicated, I know, but I appreciate you trying pronouncing it. So I'm a policy officer in the Health and Safety Unit in DG Employment in the Commission. Let me start my short speech with saying that I have read the research project report with great interest. It is very insightful for us to learn about the situation in the area of mental health and healthcare and long-term care sectors and the effect of COVID-19 to these very important sectors. What I appreciate mostly in the research project report is this focus on national examples and tools and factors which can practically help the workers in these sectors, such as supporting environment, direct participation of the worker, and so forth. We are well aware of a problem of psychosocial risks at the workplace. It's the second most frequent work-related health problem in the EU 27, just after MSDs, musculoskeletal disorders. Recent data suggest that awareness is still not high enough when it comes to psychosocial risks. And we know now as well, very well, that mental health has deteriorated during the pandemic. As it was presented earlier and also indicated in the research project report, the EU has legal provisions which also cover psychosocial risks at work. Here I talk about the Framework Directive on Safety and Health of Workers at Work, according to which the employer has a duty to ensure the safety and health of workers in every aspect related to work. And this applies, in addition, the employer has an obligation to identify and assess risks in both physical and psychosocial work environments and put in place resulting preventive and protective measures. The Framework Directive is transposed in all member states. Member states, as we know all, can go beyond the provisions of the directive, and some of them do. And some of them, they have more stringent provisions. In order to address increasing mental health problems, the Commission launched a number of important initiatives. So one of them that I want to mention is the recent communication on the Conference on the Future of Europe. in which the Commission announced that it will consider new areas of action, such as new comprehensive approach to mental health. In addition, during the State of the Union address on the 14th of September of this year, the President announced a comprehensive approach on mental health initiative. It is included in the Commission's Work Programme 2023. Parallel to this, the EU's OSH Strategic Framework 2021-2027 announced an OSH Summit 2023 that will take stock of progress since the adoption of the framework. And during the summit, one of the subjects that will be covered is psychosocial risks and mental health at the workplace. The OSH Summit will raise political visibility on mental health at work, aiming at putting forward concrete recommendations and to have commitments from member states and relevant stakeholders in this area. And then the President's von der Leyen's initiative on the comprehensive approach to mental health initiative will cover mental health at large. So it's going to be about public health, but it also will include mental health at work. So this part will be integral part of this comprehensive approach on mental health initiative. And the approach and next steps in implementing the President's announced initiative are being discussed at the moment. Then I want to briefly just mention some actions that are carried out by the agency on safety and health at work in Bilbao that are very important. So in particular in the area of healthcare and long-term care, which is the results of the survey of enterprises on new and emerging risk, SNR, in the human health and social work activity sector, published this year. They also are working on the OSH overview on psychosocial risks and mental health with several projects. And one of the projects, namely it's an expert article, is on mental health of workers in the healthcare sector. And this should be finished next year. In addition, there will be an OSH overview in the health and care sectors, which will begin next year, and then it will end in 2026. So this is, I think, very important as well. And in addition, I would like to mention, because the report has mentioned the importance of training the labor inspectors on psychosocial risks when carrying out on psychosocial risks. So I think it's important to mention the work of the Senior Labor Inspectorate Committee and their guide for labor inspectors for assessing the quality of risk assessments with regard to prevention of psychosocial risks that was adopted in 2018. And now there is a relevant working group of SLIC that is assessing the need to update this guide as well. So I thought it would be important to mention here as well. Thank you. I don't know if I managed within the time or not, but well,
no.
This is...
Thank you very much. Thank you very much again for this very good presentation and an initiative of the mental health. I think a lot of our colleagues and participants will have questions to you about that, because I think it's very important how we could support workers in the health and social services sector. So I would like to now open our questions and answer sessions. So we could now, colleagues, ask the questions to all of the participants from the research, starting from the researchers, ending on our colleague from DG Employment. And I guess, Solvik, that you are of the Lithuanian origin, because it sounds like a Lithuanian surname. So I was really right. So then, colleagues, if you have any questions to our participants or comments, you could actually raise your hand or put it in the chat channel. In the meantime, I know that we have a Kevin Flint from Eurocards who wants to make some comments about the End Stress at Work campaign, and maybe Marianne Chapman from the ETUI wants to make some comments. So Kevin, can you activate your camera?
Can indeed.
Hello.
Thank you very much, Adam. And thank you very much to ETUI and to EPSU for organising a fantastic event. It's brilliant to see so many people online. It's the first time I've ever seen a Zoom room completely full when trying to join, which is a positive development. And thanks to all the speakers for their contribution today. A very, very quick comment, just detailing some of the work that we've done with EPSU on this topic over the last couple of months. And I'll just start by borrowing a phrase from Jan Willem, who quite correctly said that there's a room for collective bargaining and agreements that all needs to be underpinned by EU legislation. And I think this is something that we've seen in the report throughout the day. EPSU and ETUI have been key players in a campaign that we've been running called EndStress.eu that is pushed for a European directive on psychosocial risks and has successfully delivered 2 reports in the European Parliament calling for this in 2022 alone. There's quite a lot of parallels with work done throughout the world in Australia, for example, with the Mind Your Head campaign that they've been quite successful with, and something that we've really seen a lot of momentum get behind in Europe. So just really wanted to thank EPSU and ETUI for this and raise a little bit of awareness on this campaign. I've already put a little bit of detail in the chat, but available if anybody would like to send a message equally to get more information. So thanks again, Adam.
Thank you, Kevin. I think it's a very important campaign for us, and to ensure that, you know, we don't have a new legislation, but we have like a legislation one document to ensure that the employers and the employees and the trade unions, the workers, will understand their rights. So I think this dedicated directive, it's very important. We have to, maybe Marianne wants to take the floor now. Marianne, are you with us? Because I cannot see Marianne Schaffman. Is she there?
She's on the list. Yeah, she's there.
I'm here.
Oh, thank you, Marianne. Okay.
Yeah. Good afternoon, Adam. Thank you, and good afternoon, everyone. Thank you very much for organizing this very, very interesting and comprehensive seminar. I think we have heard so many things in a short period of time, in 2 hours of time. Great speakers. My name is Marianne Straatman. I'm the head of the Health and Safety and Working Conditions Unit of the European Trade Union Institute. And psychosocial risk, work-related psychosocial risk, is a real important element of our work. It's one of our main priorities. We have a multi-annual project on it, multifaceted project. Paula Franklin, my colleague, who organized who coordinated the report and the guide, is active on it, but also 2 other colleagues, Oce Vagliedo and Pierre de Rastigui. So it's really, really a strong topic here already during some years. It started actually, the thinking started in 2018 when ETUC launched their resolution for PSR directive. And in reaction of what has been said in the seminar today, I like to try to organize my thoughts and to express them. So first of all, it's really important that we get a view of how do work-related psychosocial risks work, and I think this project has contributed to that very much. It's very good also that it's a targeted project on a sector. And now to go into that sector, what I have heard a lot today is staff shortages. It's the word that has been on everybody's, and it's, and that is, as Nicolas said in his introductory words, it is maybe the elephant in the room, because that is not easy to solve. It's important to press on that and to get more funding, to get more staff. But then if we go to look at the issue of psychosocial risks, and we look at the content of the report, there is the work organization as the source of psychosocial risks. Now, of course, it's really difficult to organize your work in a good way if you don't have staff. I mean, that's completely clear. But we should not forget this principle of work organization. And this principle of work organization relates to the principles of the Framework Directive on OSH. We want to prevent at the source, so we have to look at the work organization. So I think besides speaking about staff shortages, we should not forget this concept of work organization and also the concept of primary prevention of psychosocial risks. Now, and then how to do it, it's an enormous task, and I hear it's always the same. We hear about awareness raising, and we hear about regulation and everything in between, social dialogue. And I want to pose here to say here that let's not oppose all those things, but let's have a multi-level approach. I think that the consciousness, the awareness of the problem is really important, but at the basis of this knowledge, we also need to have a strong basis of regulation. Psychosocial risks are risks like any other occupational health and safety risks. They are not something special. They are not something vague either. They are measurable. They are quantifiable. They can be made tangible. It's also possible to define measures to go against them. So it's not something that is not possible to regulate. So let's regulate. Let's also continue the awareness raising. From the side of the ETUI, I think our contribution will, like the contribution also of EU OSHA and other institutes, to provide knowledge and insights. And I think, and I want to close on that note with a compliment for this report, because I think it's a really, really insightful report. I also like the fact very much that it's a report and a guide. So it's also very useful, I hope, for the workers, the unions, the representatives on the shop floor level. Thank you very much.
Thank you very much, Marianne, for that. I think it's important exactly what you said. We need to work on all levels, but we should not only focus on staff shortages, which are crucial. Therefore, we organize a demonstration on the 9th of December, but we need to focus on other part of the work, which is exactly occupational health and safety. And part of occupational health and safety are psychosocial risks factors. And we included them, as already Marta Branca said, in our updated framework of actions on recruitment retentions. We mentioned the importance of psychosocial risk factors as a way in which you could make the sector more, to make the health sector more attractive for recruitment, and also retention, because this is what Dietmar was saying about the retention. Now I know there's a questions from Paula Franklin.
Yes, if I may, maybe it's a reflection, and then at the end there might be a question for Solveiga at the European Commission. EU OSHA, the agency of the European Commission for Health and Safety, they published their flash barometer of workplaces just recently. I think it was a month ago, and it showed that the COVID-19 pandemic had made it easier to talk about mental health at workplaces, which in a way is a positive result. But at the same time, it still showed that psychosocial risks are not so easy to talk about. And here I would like to reflect slightly about that. We need to talk about the same topic. And when we talk about mental health at work, sometimes it becomes a little bit blurred. So we can talk about workplaces that support the mental health of the worker due some difficult situations in their personal life. So this is one way of accommodating workers' needs. However, in this report, specific to health and care sector, but also the other work that we do at the ETUI is that we're looking at the risk factors in the working environment and this prevention. So Solveiga, would you have some information on us how the European Commission is working on this kind of the two sides of it? So moving away from the looking at the individual mental health as something that needs to be treated or cured. This is one part of it and important, but more towards the OSH realm of prevention of the risks at the collective level. So how to move with this with the understanding further that these are slightly separate issues. Thank you.
Thanks for the question. Indeed, I think COVID-19 has deteriorated the problems in relation to mental health, but at the same time, it's now a great momentum to act upon this because the awareness of the problem is a bit everywhere. So it's very, very visible, and it's very, even in media, I think on a daily basis, we can read information about this. So it reached also the general public. Yeah, on what the Commission has foreseen, it is actually, so what I told you about, but maybe you would classify this in this, more like holistic, and awareness raising section. It is this very political high level initiative, which is announced by our president on a comprehensive approach to mental health, where we want, of course, we are at the level of the EU, but there are many different actors between the level of the EU and the citizen, the worker who needs help in relation to mental health at work. And all of these actors need to work together. So when we talk about, it's again, I want to repeat myself, it's actually about the OSH summit that we have foreseen next year. We want to raise the political visibility on mental health at work. So hopefully this would then also make it easier to talk about these problems, to contribute. I don't think that this event will, contribute in itself, but contribute to the elimination of stigma talking about these problems, because definitely there is a problem there. And also the aim is there to have concrete recommendations and to have the commitments of member states and relevant stakeholders to do something about this. So I think this is very important initiative. And in addition, the president's initiative to have this comprehensive approach to mental health, which would then include not just mental health at work, but mental health in a much broader way, part of public health, sorry. And then what we will achieve in the OSH summit would feed into the this comprehensive approach. So this is what we have foreseen on a more kind of holistic, more general strategic view. And then we always put forward the very practical tools that EU OSHA is developing, and they are translated in many languages, the guides, the tools for risk assessment, and there it's really, the organizers, including yourself. I mean, you could also maybe invite, if you don't do this regularly, EU OSHA experts to have presentations about these very important tools that can actually help on a very practical level. So, not sure I replied to your question, but this is my best shot. Thank you.
Thank you very much. And the EU OSH summit is next year. What time again, Solveiga?
May. It's in May.
In Bilbao, right? Or here in Brussels?
It's going to be in Stockholm because it's going to be related to the Swedish presidency. Yeah.
Okay, so we will be probably, some of us will be happy to go there to participate in this very important summit. Dear participants, do you have any questions to our speakers, to Solveiga? If not, you could send us your questions per email maybe, or in a chat channel, but I don't see any questions. I think the report was so good and excellent and so long that people are probably still reading this, Paula and colleagues. We have this report in many languages, or only in English, or which languages?
So the report is in English, and then we have the trade unions guide. We have in English, German, Spanish, and Swedish. So it's a kind of like an accompanying product for the reports. And actually, when we've been talking about legislation, the trade unions guide also includes some findings from another ETUI report in which a colleague was mapping out, looking what is the situation of legislation of psychosocial risks at the EU member states. And we have very clear maps there showing that there are huge discrepancies, that there are huge differences between the member states. And from that, concluding that the workers in health and care sectors, but also in other sectors, are not protected to the same level. And even if we would have lots of information and tools available, it doesn't necessarily mean that they're being used. And we also heard from Clara Lloren-Serrano, based on her research, risk assessments are not always conducted, especially not on psychosocial risks. So just to put that out there as well, that we do know we have a lot of information and we acknowledge this as a problem. However, we are stuck. So we're hoping that in terms of this report, the trade unions guide, that we can move forward together to really identify what are the levers that we now need to use. Like Marianne said, the combination of measures to really protect the health of workers.
Yes, and I agree. We send you this trade union guides. Then there is a questions one in the chat channel, but I think to this question we could maybe summarize our discussion. So the question is to you. It's from someone called user. How and in which way the social partners can help this case nowadays? I mean the case is probably to improve the psychosocial risk protection. So maybe that's the questions for you, actually, for Silvian, then Marta, and then Dietmar, representing our social partners here. And then we could slowly go and close the. So Silvan, yeah.
Thank you, Adam. There are many means to deal with this question. First of all, what we do today at EU level together, EPSU and social employers, we are part, as I mentioned during my intervention, we are part in projects where we will gather soon some good practices in terms of working conditions broadly, but there will be a topic on psychosocial risk. We will also, in another project that we submitted to the Commission, work on recommendations about whole of the working conditions topic, and with a focus also on one of the topics is psychosocial risk. Further, we have already been contacted by the project manager of a project that Solveiga mentioned, the occupational safety and health overview about health and social services. We will work together with him to gather practices and build some tools at EU level. And there are many other things we can do. Of course, there's a regular social dialogue which can be led at many different levels, and also at informal level, close to the ground, which is super important, between employers and employee representatives. So that's it. I don't want to say everything. I leave the floor maybe to Marta, if she wants to contribute.
Sorry, I lost the question. So you can repeat the question briefly for me?
So the question is in the chat channel, Marta. So how social partners can help to help this case nowadays? So how social partners can help to
with psychosocial
can help with psychosocial risks nowadays?
Okay. Yeah, we're doing a lot of initiatives as social partners, and I think that the role of social partners are fundamental due to the fact that social partners know perfectly which is the problem, how to deal with it, and moreover, the collective bargaining is the best way to improve the situation, as in this way both workers and employers manage to take consciousness of the problem, so and to be persuaded, for example, in starting new initiatives and make risk assessment and be really conscious of the problem. So I think that the initiatives that social partners both at European and national level are really crucial, and this is why we strongly support the capacity building in social relations between partners, because in some countries, unfortunately, this kind of relation are not so developed. So we have to fully support and even help these partners. I mean, we as employers and trade unions as trade unions support and teach and take the hand of these colleagues to show them how to deal with a good social relation in for every problem, but especially for this kind of situation, this issue. So I think that definitely is even more than the directive and then the legislation. The social relations are important in this moment to overcome the psychosocial risk, included the mental illnesses that can affect workers, especially after the pandemic. Thank you.
So thank you, Marta. So now Dietmar, and after that you could also start making your closing remarks. So now it's Dietmar, the question to you, and then closing remarks, and then Marianne, and we could officially close the meeting.
Dietmar, et puis Marianne, et puis on pourra clore officiellement. Yeah, thank you very much, Adam. What we've seen again today, to get back to the question, is that altogether with the employers, we can change the situations. Of course, there are also differences between employers and trade unions organizations. We've seen, for instance, that employers don't necessarily want to have new legislation to solve the problems. They would prefer solving the problems by themselves. However, as far as trade unions are concerned, let's say us, we need legislation to have everybody on an equal footing and to improve working conditions, because we need to avoid bad working conditions and employers making money to the detriment of workers. So we are asking to the Commission and to national parliaments to legislate. We need directives on OSH, on safety and health at work. We also want national parliaments to develop regulations on working conditions so that we can improve them in a sustainable way. But despite of that, we see that collaboration between social partners, between employers and trade unions is good. Thank you very much to Clara Branca. And we've met today to look for solutions all together, because we're here talking about social dialogue for hospitals, and also social dialogue for social services, if possible, in the future. And we are committing ourselves in the framework of social dialogue, and we commit ourselves to implement our decisions. We work on staff retention and many other issues. And it's really a fruitful work if we implement all that we do at European level, at local level. And to answer the question, you see that we're working together, we are talking to one another, and this is really key. And to conclude, I would like to say thank you very much for organizing the webinar. We see that there is an interest, but there is also some pressure, and this will be taken on board in our future work next year and the years after. So the floor is back to Adam.
Thank you, Dietmar. The floor is back to Marian, who needs to officially close and make the final conclusions from this important meeting. Marian, the floor is yours. Sorry.
Thank you, Adam, and thank you for the trust you put in me to do the final conclusions of this webinar. I hope I won't repeat myself too much, because of course I said already something. I think there are different elements that we have to take home from this webinar. First of all, as Paula stressed in her contribution, it is the way in which we frame the problem of psychosocial risks at work. It's not something of the individual weakness or lack of resilience or whatever. Work-related psychosocial risks have their origin in work and in work organization, and that must be very clear. So it must also be, I think it's really important also in reaction to Solvega and the European Commission, this mental health initiative. It's really good that both elements are in there. It's much appreciated, but it must be very clear that mental health in let's say mental health of the population is really, it's another topic than work-related psychosocial risks. Work-related psychosocial risks, we cannot repeat it enough, are work-related psychosocial risks. They find their origin in the work organization. So it's the framing of the problem is really important. And then how to tackle it. We always hear a lot about awareness raising. I think apart from awareness raising, it's also deepening the insight and the knowledge. And I think it's really important that reports like this, guides like this appear, let's say, on the market, free for everyone to use and also to exchange, as we did today here. I mean, with many people, which shows the importance and the relevance of the topic. So apart from awareness raising, deepening of insight and knowledge, especially for the people that need to solve the problem. And then, and of course, the tools to be also out there, the EU OSHA tools are also very important. The thing is, how do we make them used? How do we make it, make them effective, and also in places where maybe that is not so easily done, or for whatever reason. So there, of course, the social dialogue is important. It's really important to have the social dialogue to come to agreements. But also social dialogue is not strong in each and every country. So so that's there is differences there. So therefore, the trade unions really make a plea for a good regulatory basis. It's also something that ETUI has focused on in its research. Our colleague Otse Valiello has made a mapping of psychosocial risk regulation all over Europe. And the most important conclusion from that, well, there are many conclusions, but one of the important conclusions is that it turns out to be possible to regulate psychosocial risks. So it's not something. So if it's possible in the member states, then it's also possible at EU level. What should be in there? I think the cornerstones of the problems should be made clear, and the minimum requirements of how to deal with the problem, like in any other OSH risk is the case. So that's it. I think we are 8 minutes past the time. So I want to thank all of you for this very, very interesting and comprehensive, fruitful webinar and discussion. I think I'm especially also impressed by the number of participants. It shows really the importance and the relevance of the issue. And I want to a real big thank you also to the speakers, to all the speakers that gave us their time and their insights. It's good to discuss. I like the setup of this webinar, short presentations and a lot of exchange. I want to say thank you also to the interpreters, without whom something like this is not possible. And a big thank you to the organizers of this seminar. So thank you very much, and hope to see you again.
Yes, thank you very much, Paula. So we thank you for participating. We now stop recording.